Well, good afternoon, everybody, and welcome to today's topic, which is care expectations. I've been looking forward to hearing about that myself. Talking about home care, assisted living, and long-term care issues. And of course, today for our daily broadcast through our financial wellness broadcast, as some of you might be joining us for the first time, we broadcast from 2 to 2:30 every day and have a different guest on a different topic. And then at 2:30, we do kind of keep the lines open for additional questions. So we're happy to have you with us today. My name is Jerry Snyder, and I'm going to be your host today. And I share those duties with Jay Lindner. So thank you much for joining us. Because some of our speakers are involved with the financial industry, I'm going to bring up a disclosure that give you a minute or so to look at that. Some of our speakers also are actually on the board of directors of COPEC itself. So I'm going to kind of stay silent for a while and let you look that over, and then I'll join you briefly. Well, thank you for your patience. Again, I think we have some people rejoining us from prior sessions, but for those new people, I wanted to mention again, these programs are brought to you by COPEC, Central Ohio Professional Education Council. We're a nonprofit organization that started in about 2004, and our mission is strictly to give good educational information without any attempts at sales or marketing. We do live stream these programs every day. Therefore, occasionally we do have some technology problems or connectivity problems. If that's to occur, please be patient and we'll get those working for you just as soon as possible. Now, as I mentioned, we'll have this question and answer session, but feel free to ask questions as we go along through your chat box. Again, we'll all except maybe holidays, we'll be with you at 2 o'clock every day. If you do enjoy the information that we're presenting, we want to make sure that you're comfortable in sharing that with friends, associates. Maybe you belong to another nonprofit or a corporation that might be of interest to them and helpful to them. On the right side of the screen, you'll see a list of our speakers. We're very proud to have them with us and part of COPEC. And throughout the year, you'll be able to hear from them sharing their expertise. I do want to draw your attention and have you at some point go into the copeceducation.org website. On there, you'll see the financial wellness portal. Maybe you signed up through that portal. And I want to draw your attention to about 6 different tiles on that program to access good and valuable information. Obviously, the one tile is what we're doing today, the daily webcast. Another tile, though, and by the way, we are programming our topics out through the end of the year, and you can kind of pull it up on the website and kind of see month by month or month in a glance. And so we would love to have you join us every day, but you may want to focus in on certain programs so you can kind of look ahead and see what might interest you. Retirement decisions is another tab, and that explains programs that we have 2 or 3 times a year. We've often held those at the Fawcett Center, but due to the COVID, we're going to be Zooming those programs as well. And they're an in-depth program dealing with all aspects of retirement planning. We delve into the state pensions as well for those under OPERS and STRS. So look forward to that. I know on September 17th, we're having 2 programs, one at 12 o'clock and one at 5:30. Sign up through the portal here, and we will give you instructions to tune in with us for those, September 17th. And also then we have Find Out Financial Wellness Fridays, another tab, and those begin at 11 o'clock, and it's more of a lecture series on many of the same and additional topics to go into those topics in greater detail. And then also, you'll see a tab that says financial education, Again, it's just a reminder that if you want to share these with a department within your corporation or a nonprofit or any individual friends or neighbors, they can access this portal. Then finally, and importantly, is 15-minute free consultations, no-cost consultations. Most of our speakers offer these following their program, or in the future. You can access these at any time. And you may have a question that didn't get fully answered during the program. Maybe there's a question that requires a little bit more of a personal privacy type of response. That is the purpose of those. So please take advantage of those as well. Well, thanks again for joining us. At this point, it's my pleasure to introduce Marcia Strall to talk about this important subject of care expectations. And so Marcia, I know her very well, and I've had the pleasure of sitting on different boards with Marcia as well as interacting through client needs. So Marcia owns her own company, ElderLife Solutions. And Marcia, I don't know if we wanted to deviate a little bit. People might be interested in knowing this whole area of elder law and how you became involved with that to begin with, and then we'll get into the topic.
Well, ElderLife Solutions has been around over 20 years in the Columbus area. We're a geriatric care management company. A couple years ago, the national organization changed the name. It's now called the Aging Life Network. So if you have loved ones in any part of the country or are looking for a care manager, a professional licensed care manager, you can look at the aginglifenetwork.org and find in the zip code that you're looking for a care manager. Care managers do a little bit of everything. We are professionals with much experience in the areas of aging in place, facilities in our geographic areas, helping you through the maze of medical and medical insurance, long-term care insurance, whatever the case may be. Often our clients are individuals who have families that live out of state, out of country, out of town, and we assist them and can be the eyes and ears in attending doctor's appointments and advocating for those clients during those sessions so that everything gets relayed to the doctor and the doctor is able to explain things to the client, and we are their extra set of eyes and ears, and we can ask questions and advocate just like maybe a family member would if they could be with them at that time. A lot of our clients are older individuals still living in their homes and just want another set of eyes and ears to come with them during medical procedures, during medical appointments, that type of thing. Or sometimes it might be they're thinking about moving, the time has come to think about downsizing out of their homes, what the best place would be for them. We base that on a lot of individual contact with them, their geographic area, obviously their finances, because care equals cost, as you know, Jerry, whether they have long-term care insurance, but we're just not a service that will throw out 5 or 10 names of retirement communities. We really look at what the individual needs, medically, socially, all of that, and then look at their finances to see what they can afford short-term, long-term, whatever the case may be. So we do a lot to help individuals. We're private pay. We can do as much or as little as you need us to do. Like I said, we've been in business for 20 years and, we've worked with a lot of your clients as well, Jerry.
Yeah, I know from personal experience, one of the great things I think you've done is to develop a plan of care for somebody, a complete plan of care. Most people that haven't had experience with this come in and they don't know where to start and what to do. And so you've done that a very valuable job, I know.
And I know it's always, yeah, here's your plan of care, but we like to look at, we're very common sense based. We know that the best laid plans, especially when you're dealing with aging, can go awry. So we usually plan A, plan B, plan C, I'll be honest with you, to best case scenario, worst case scenario, and somewhere in between.
I see. Now, you picked the title Care Expectations. When you picked that title, what did you have in mind?
Well, I think the three basic levels of care when you need it, with medical type problems, you would be looking at a nursing home, assisted living, or home care. And what are the differences in those levels of cares? What should be your expectations in those levels of care? A lot of folks will get a hard sell from a facility, go in and realize this is not the place I need to be. I should have looked further, and perhaps maybe I need, I went into this assisted living thinking they could handle all my care needs, but unfortunately that's not happening. And maybe a long-term care facility is what I need in the short term. Or maybe, you've been diagnosed with more of a chronic disease that you can expect to get worse as time goes on, and you want to change your residence. You might want to only move into a place that one time that can have different levels of care within that situation. And that's what we look at for as far as a plan of care. But what are your expectations in each of those levels of care? And today I'll touch a little bit also on cost, because care equals cost, what you can afford oftentimes.
I don't know if you're going to bring this as a part of your talk, but maybe I know some home care agencies are have a medical model, and some are just non-medically based, I guess. And I even have difficulty kind of figuring out the difference on those.
Right. We're aware of that. And there are agencies out there too that don't charge for, quote, facility fines. Certainly, you can be given a list of facilities at the hospital, when you're being discharged, if you have to go for rehab, that your insurance takes. But how do you know which ones are good? These facilities oftentimes change hands, change ownerships, change nursing directors. We kind of keep our fingers on the pulse of what's happening because we're in and out of those facilities. I should say that with a caveat, because right now you can't go in and out of those facilities due to the COVID lockdown. But certainly with our experience over the course of the years, we know almost every facility in Northwest and Central Ohio, and we work in a 5-county area. So we're aware of the situations in those facilities through agencies that do keep track, and then oftentimes you won't see what the real deal is. If they lost their nursing director, that goes a long way to, making a change in the care that's being given to the individuals.
So it sounds like you're kind of a matchmaker. Does it usually start with really figuring out what the medical needs of the patient are before you do anything else? Is that?
And also their social needs. I'll be honest with you, a lot of folks, especially if your children are looking, if you're a child or helping your parent, or, you're thinking, oh, this place is so wonderful. It has swimming, it has this, it has that, it has that. But your parent has never done that. We can be the voice of reason and kind of negotiate between parents and children, because oftentimes you don't want to jump into a place knowing that, yes, I know I need to go somewhere, but maybe that's not, I'm paying for a lot of services that I'm never going to, use. I've never been a social person. I go to church. I like to play cards, but that's about it. I like to be my alone time. I like to read. I like to knit, whatever it might be. And there's no sense in going into a really high-end place with all paying for all these services or availability of services if you're never going to use them. I always say that Central Ohio is blessed with a lot of facilities, and a lot of these facilities are very different, and a lot of them are the same, but there's some place for everybody. And we like to get to know our individual people, both their medical backgrounds and what's going on with them, and their finances. We would never refer to a place that they couldn't afford long-term. As care managers, we like to kind of look at 1 year out, 5 years out, and 10 years out.
So you're taking a holistic view of the entire situation.
Absolutely. We work closely with a lot of financial planners. That's how I got to know you, Jerry, to know, what folks can afford. And also with, the families that, is it better to be a place near a family member where they can visit more frequently rather than be in your own neighborhood where maybe you're not going to be driving so much. Right. We like to get to know the families and their social aspect as well as financial and as well as medical.
For the folks tuning in, I wanted to mention we have a lot of programs over the coming year. We're doing a real high flyover today because of limited time, but we're going to drill down on a lot of these issues in more detail. How to talk to loved ones about the sensitive issue of long-term care. We're going to go into these facilities much deeper in our discussion as to what the amenities they offer and things of that nature. So with the time that we do have, where do you think we ought to focus the discussion at this point, Marcia?
Well, I did bring a little bit of a slideshow. I'd like to put that up. We can just, base our discussion off of the slides if that works for you.
That's terrific.
And if I can get it up. Here comes the technical difficulties.
We promised the audience that would happen. So do you have a share a screen button there? Or?
I clicked it and it says, this will stop other screen sharing. I want to continue?
Yes, you do.
Okay, then we're good to go.
Okay, good. Yep, I think I'm.
Are you seeing it?
I am not, but.
Oh, I see. Hang on. There we are.
Hey, super. We're good to go.
Okay. Well, you all know who I am, so we'll just move on from there. I thought we'd talk about nursing home a little bit first, about how to qualify, what to expect as far as qualifications, because it's not always a gimme, and a little bit of cost. I just thought, we'll breeze over it. I'll hit the big points. If let's use the example, you fall at, or mom and dad fall at Kroger's, break their hip. They're in the hospital, they have surgery. What happens next? Let's say in this circumstance, they need to go to a nursing home for rehab. Most insurances through Medicare, whether it be a Medicare supplemental or a Advantage plan, require you to have a 3 midnight stay that will trigger your skilled Medicare benefits. That's your rehab that will be paid at 100%. Some Advantage plans don't require that 3-day hospital stay. So again, that's an insurance issue that we would look at. But most people, if they say they live in a 2-story home, they're going to be non-weight bearing or whatever it may be with a hip, will go to rehab or become very, a little more deconditioned. So usually with a 3 midnight stay, that rehab stay, while they are getting therapy in the rehab center, will be covered under Medicare at 100% with that 3 midnight stay. Or maybe it's someone with dementia, let's say that family's been taking care of them at home and it's time they feel to go into a situation where they would need a nursing home level of care. There is a pre-admission screening resident review called the PASSR that the state does before they come in to make sure they're at the level of care of a nursing home. So those are 2 ways to qualify an admission of a nursing home. The cost, of course, Medicare is skilled. Usually when you're there and you're skilled, Medicare gives you 100 days. You don't get 100 days per that broken hip. You probably only get somewhere between 7 and 21 days skilled, paid at 100%. It just depends on your progress. There's a lot of moving parts for that as far as therapy. But that's a way to have Medicare pay at 100%, and there's no private. If you have to stay after that, you're looking at private pay. Private pay on average right now in Columbus and Central Ohio is around $324 a day for a semi-private room. And that's kind of an eye-opening number when you think about it. Private rooms you can usually add, it depends on the facility, but you can usually add about $20 to $40 per day for a private room, and usually they're hard to come by. So it just depends. Usually though, anymore when you go into a facility skilled, most of those rehab rooms are private rooms. It just depends on the facility. But again, that's a question to ask when you're in the hospital getting ready to decide where to go for rehab.
Do people usually have a choice as to where they go if they're in the hospital and need to go to nursing
Yes.
facility?
It usually has to do with what insurance they have. I'll tell you that. And usually the social worker or the discharge planner in the hospital will bring in a list. You can request a list of available nursing homes that you would, want to go to. Typically, when we help people out with that list, we talk about geographic areas so someone can visit them. Although right now, that's not an issue right now. We will tell people, where is the rehab? Is it on a first floor room? So people can come to the window to visit, because that's all that is allowed at this point. Some facilities are allowing once a week visits outdoors under a covered roof. And there's talk about how they're going to do that once the weather changes. But I'm speaking in general terms of how things are usually, not how things are now. It's unfortunate. But, that's, if it's a semi-private room, hey, can I have the window bed because I want to be able to talk to my family through the window when they come and visit, that type of thing for right now. But yeah, semi-private rooms, and then, other paying sources that you can think of for extended long-term care after skilled would be long-term care insurance would pick up a portion of that usually. I don't know, Jerry, maybe you can answer that. I don't know any long-term care insurance that would cover $324 a day.
No.
I think the average is about $140 a day from what, my research and my clients use. So you're still going to be on the hook for a good chunk. Medicaid is an option there for nursing home, but you have to qualify by reducing your assets. And I know, I think Russ Gollowin is going to talk about Medicaid later this month in one of these webinars.
Yes, he is.
The other thing that I didn't put down here, and I should have, is the VA. You can get help from the VA as well if you are not in a position to apply for Medicaid. If you're a veteran, or if your veteran has deceased and you're a spouse of a veteran, you can look at that as well.
Great.
So what do you expect when you go into a long-term care facility? You expect that they will have 24-hour nursing. That's the law. You expect that when you go in skilled like that, a lot of people don't know that that physician who is assigned to that building or who is the medical director in that building becomes your primary care while you're skilled. You may have a primary care outside in the community, but while you're in that skilled and Medicare's paying at 100%, the physician that's at that facility is your primary care. So again, the question, who is your medical director, is one to be asked before you go into a facility like that. And usually you only see the physician once a month in these facilities. Again, it depends on which facility, but more likely you will see his nurse practitioner weekly. That's kind of how that goes. Medications, while you're in a nursing home, long-term care situation, you would expect your medications to be given to you by the nurses, an RN or an LPN. Usually within 7 to 14 days after you're admitted, you will have a care conference, which you want to have, and that should be with social worker, director of nursing, or the unit nursing manager, OT, PT, speech, activities, and dietary. They all should be in one room. If your loved ones can't come in to attend that meeting, then they should be on a phone call, a speaker phone call, so that questions can be asked. And that's when they develop your true plan of care and give you expectations for your goals of getting out to go home, or the possibility that you may have to stay long-term depending on your medical situation. You should expect a caregiver response when you activate your call light for help within 15 minutes. If you're not getting that on a regular basis, that's cause for concern. And you would need to address that in a care conference or with the director of the facility. You could expect intervention of physical, occupational, and speech therapy if needed and ordered by a physician. Most of the time when you're there skilled, it's automatic. That's why you're there, is for rehab. if you've been in the facility for a long time, or your loved one's been in the facility for a long time, and they're all of a sudden maybe aren't doing as well, haven't been able to, a little tipsy while they're walking, that type of thing, it doesn't mean because they had therapy last year, it doesn't mean they can't get it again. It would be under Part B because they wouldn't be skilled, but Part B, Medicare would pay for therapy to see them 2 or 3 times a week, depending on the need, and maybe get them back on track again. So just because they've had it once in rehab and maybe they're staying there long-term, doesn't mean they can't have therapy. You can ask for that.
Now, Marcia, does most of these facilities ask for a contract to be signed?
Yes. And they also ask a lot of times, and that's what throws a lot of our family members, is who's going to guarantee payment. And that's why we always are very clear with people about what the financial expectations are in these situations. You know, the costs are large. I mean, you can be in excess of $10,000 a month in a long-term care facility. So you need to know that you have the money to pay for this if you're going to stay long-term, and what the expectations are.
To get a contract like that reviewed, is that something that a care manager like yourself would do? Or
absolutely.
do they need to go?
And if need be, we would call in the person's attorney if there was any question about the language that was written in the contract.
Okay.
So again, you should expect a dietary intervention, activities intervention. And when I say activities intervention, I mean not only what activities you can go out to from your room while you're there, but also if in situations like right now during the COVID lockdown, they're not having groups get together in these facilities. So there's no, most facilities aren't even having communal dining, which is where most of your socialization comes in if you're in a facility. So these, what they call one-on-one visits with the activities department are very crucial at this time to avoid depression and just the feeling of helplessness and being alone. And expect that you would have access to the RN unit manager for any issues that come up. I would really encourage anybody going into a facility to get to know who the physician is and their contact information, the nurse practitioner and their contact information, unit managers or director of nursing, that you have their direct contact information. Emails are always the best because phone calls, you're not going to get anybody. I'll be honest with you. And that can be very frustrating, but emails, you usually get a prompt response. So those are the expectations for long-term care. They do, 3 meals a day, everything. But right now with the lockdown, like I said, it can be very, a lot of facilities are not taking new patients right now during the lockdown. Some are. Another question to ask right now is, do you have a unit for COVID patients? Because some places are taking COVID patients from the hospital recovering, which is fine. They have a separate unit and everything's separate. But a lot of folks don't want that. They don't want that exposure even under the same roof or on another unit. So that's a question to ask right now if you are going into rehab. Or the other question is, do you have any active COVID patients right now and how are you treating them?
Mm-hmm. Well, Marcia, you're a tremendous resource because you've had the personal experience with many of these facilities. In addition to you being a resource, is there other resources that they can go to?
The Ohio Department of Insurance has a website as far as costs and things like that. The Ombudsman Program, the Ohio Ombudsman Program is a great resource for complaints, formal complaints that you have regarding facilities. If you feel you're being discharged from the hospital too soon to the rehab facility, KeyPro, especially if they're a Medicare, under the Medicare umbrella, is a watchdog for Medicare. And you can call KeyPro to talk about, I'm still running a fever, I still have an infection, there are reasons that you feel you're not ready to leave the hospital. That's an option as well.
I'll put a little plug in for the Upper Arlington Commission on Aging. I know Marcia is on that board and some of our other speakers are as well, but they can be a tremendous resource. Obviously, they serve a lot in the Arlington community, but they do have a resource directory, I know.
Yes, absolutely. Upper Arlington is a wonderful resource directory for Northwest quadrant of Columbus, but also the Central Ohio Agency on Aging puts out a wonderful booklet as well yearly. And that also has a lot of resources that has a list of facilities and that type of thing. And like I said, the Ohio Department of Health also, you can look at how many COVID patients are in each facility. It goes by county, and the Franklin County or Delaware County or whatever county you're looking in also has that list of facilities that have been affected.
Great. Well, again, one of the frustrations is we have limited time. And so I think we're going to defer maybe the assisted living part of the discussion. We'll invite people to come back to another program.
Okay.
We'll stay on here and kind of switch over to the question and answer period. But for those that need to leave at 2:30, I wanted to thank them for joining us. I'll take just a few seconds of separation before we go into the question and answer. So Marcia, formally thank you for joining us today. We are going to have many additional programs, assisted living and home care in greater detail, as well as many other related issues on financing long-term care as well. So thanks again, Marcia. Stay with us, everybody, and I'm going to switch over.